Thank you. I don't know, Debbie, you're kind of in the darkness there, and you're flashing, and not in the basement, by the way.
Yeah. No, not. Yeah. That's what happened. That's what happened last meeting, too.
It's weird.
I'd come in. I didn't realize we could come in for the meetings. I'd rather be there than flickering.
Gary Kashek is on he's signing in now. Okay.
See?
Councilor Kashak is on his way signing in.
Let me mention it to
All right, thank you. Thank you, everyone, for participating in our board meeting today. And so I'd like to call the meeting to order. And first, I'm looking for agenda approval on the agenda as presented to you. Judy moves and Reno support. All in favor? Opposed, if any? That's carried. On the agenda, is there any conflict of interest on the agenda as presented to you today? Okay. Update. COVID seems to be our favorite subject of the day. COVID-19 update, and I'll call upon Dr. Ahmed to give us an update on 4.1. Dr. Ahmed?
Thank you, Board. So with respect to COVID, we're seeing a decline in our number of active cases in the community. We are gone less than 100 active cases in the community. Most of them are still in the agri-farm sector. That is also relatively under control. We have one farm that has, I guess, most of the active cases. Other than that, the farm numbers are significantly down. We are working with the current farm to make sure that everything they need to do to manage and contain the outbreak is happening. And we're working, our team is working on that. Along with some of the other health sector partners that we are working with respect to the isolation center. Nicole Dupuy is participating in those conversations. And as we know that emergency management team that came down from Sunnybrook Hospital, they are leaving this weekend. And they are looking for a transition plan, which is currently underway. But right now, the capacity or the people who are staying in the hotel is relatively low. We anticipate that work will continue. So there are a number of conversations that's happening that how we will sustain that plan. The rest of the community picture looks relatively stable. We are still seeing some odd cases as a result of community spread, but most of the cases continue to be among the close contact. We are right now working closely with school boards with their return to school plan. I've attended a couple of board meetings with the school board to provide the input and support, answer any question that they had from a public health side. Our team is working directly with the staff and also addressing many of the challenges. But we understand that it continues to be the hot topic right now in the community, return to school. So we're working on that. We're also keeping a close eye on all the workplaces that we have in the region and looking at it actively to identify any active case or concerns in the workplace and take appropriate action. So that's basically in a nutshell, that's what we are dealing with, and happy to answer any question.
Thank you, Dr. Ahmed. Is there any question directed to Dr. Ahmed? Yes, Larry.
Yes, to the doctor. Maybe this might not be the time to ask you, but doctor, to go to the libraries, okay? Is there any way, I guess we can't enforce the mask bylaw to apply to the libraries. Is that correct?
So there are a number of ways that can happen, but I think maybe just to give a little bit more update on the library piece, we did had a call with our CEOs of all the municipalities, or at least whoever attended today.
How do you get it out of there?
Excuse me, can I just ask Ed if you can mute your while we're here? We're getting a lot of feedback.
Yeah, so with respect to library, we did had a conversation with all the CAOs this afternoon, and based on some of that conversation and discussion prior, we will be with the interest of the municipality, we would be adding the libraries in our Section 22 order to cover the entire region, recognizing that the libraries are, especially the Essex County Library, is in different municipalities, different municipal building, but operated by the county, and create some operational challenges in terms of the enforcement. So we will be including that in our Section 22 order, which would be updated with some of the language around the library.
Okay, thank you, Doctor. And just one other question. Are the municipalities in a whole following our guidelines recommended by the board or by the health unit?
I didn't understand your question correctly.
No,
I'm asking, are the rest of the municipalities following the guidelines handed down by the health unit?
With respect to libraries?
Yes.
Yeah.
Yeah, maybe I can jump in on this, Dr. Ahmed. The town Tecumseh, libraries are owned by the municipality or the lower tier municipality. We enacted a must-wear mask policy to all our municipal facilities, like the arenas, like the community centers, town hall, and we've included our library. And so we have a must-wear mask out of our library because we own the building. It might be operated by the county, but the facility is owned by the town. So
Okay, great, Gary, because we're doing the same thing. I just wanted to know if we're all on the same page. Thank you.
Leamington also, it could be corrected, but Leamington has put a bylaw as well and included the library into their bylaw.
Thanks, Gary.
Anybody else? Question? Yes, Reno, and then Fob.
Thank you.
Yep, go ahead.
Hello, sorry. So the question is about the back to school plans, and I know that Dr. Ahmed's been working with the school boards to prepare the plan. A lot of the issues in the main quite social I know
You're really breaking up, Reno. Reno, you're frozen.
Audio video platform.
If you were to say take your the video off and just have your voice, Reno, the buffeting might be easier.
Okay, sorry. So the question just basically is, I know a lot of the questions revolved around the amount of kids per classroom, and I know that there's been struggles because the school boards weren't increased funding and things for that. Once the plan is enacted and once we see, because they still have the choice for at-home learning, will the health unit be involved with assessing those plans and even going into schools to say, you know, this is definitely too close, not spread out enough, too many students in this class? Or will it just be sort of submitted as to what their reality is?
I can respond. We are working with the school boards in our environmental health department to do a video and like a walkthrough risk assessment, but we will not be going into each and every school to provide that one-on-one. We have 163 schools and 20 public health inspectors. So we will be supporting all of the schools. We've been in conversations with the superintendents and the school board liaison people and continue to work with them on all of their plans.
How will we deal with complaints? Like if parents complain, for example, if they feel that there just is too many kids in it. So, and these are just some of the things I'm hearing. Too many kids in the classroom, they're not 6 feet apart, and a complaint comes in. Will you simply, or will you then do an assessment of the actual classroom? Because I can assume that some classrooms with lower kids and more square footage will be able to work, while others that are smaller with more kids will be more problematic. So will there be people dealing with individual complaints like that?
So from the health unit perspective, we continue to get complaints across the board, and we're hearing from lots of parents right now about their concerns. We're hearing from teachers about their concerns. We have a dedicated school line for teachers to access and for the schools to be able to access us. And we also have lines that are coming into our health unit now for concerned people. The complaint process, when you're saying, will we be going physically into a school? Any complaint that the parent has will probably go directly to the school. They'll hear about it first. Our attention right now is trying to work out what an outbreak looks like in the school, what measures would come out of that, what practices, protocols are in place to ensure a smooth communication system and quick action based on even one case in the classroom. So at that point, our health inspectors are involved and have been previously with any outbreak in the school. They're out there. They work with the occupational health and safety reps at the school boards directly. But we're talking about a Ministry of Education that has many things in place and many protocols already.
Okay, thank you.
All right, Fabio?
Thanks, Chair. I guess a few questions. The first question, Dr. Ahmed, if you could, we had discussion about this a bit at our last board meeting, and if you could clarify to the public, because I think there are some in the community, and I'll be frank, some that are politically motivated, who are of the view that if we amended Section 22 to grant you more powers, that you would have superpowers and be able to do things that you currently don't or are not able to do. And could you clarify to the public, what is the reality and what is, I guess, some of the rhetoric that at least I've been aware of and have heard following our board meeting last meeting.
So again, I can, a lawyer can probably explain it much better than me, but what we can say is we operate under the Health Protection and Promotion Act, and under the Act, the Medical Officer of Health has given certain responsibilities, and this Act was created right after SARS to give the flexibility and ability for the local medical officers of health and the local public health unit to act and take action in cases of any communicable disease threat, and to take actions before other levels of government can take action and put systems in place for the broader public. So locally, we do know that there are a number of issues that are very local, that are very specific to the unique region, and any levels of government, any levels of engagement, it takes more time for all of these things to take action. So Section 22 powers for the Medical Officer of Health is given with that thought that any threat of communicable disease can be dealt with locally based on a reasonable and probable ground. So any section order that we issue at our local level, there has to be a reasonable and probable ground before we can enforce that order. And then that order, what we issue is also subject to appeal as well. And there's a process, there is a legal process for that as well. And it's not that whatever I feel I can put in the Section 22 order and ask people to do it. I have to have a strong justification and rationale of how we are using that power. And In theory, anything can be challenged, anything can be questioned, and the whole credibility of the system lies on the appropriate use of this power, and we take that responsibility very seriously. And again, many of these powers, it is attached with the medical officer of health, but we do feel that as the public health unit and at the leadership level, we do have some of those conversations, and we work together with our partner as well and identify any gaps. We also work with other medical officers of health in other region to get a sense of what they are doing, how they are addressing many of the issues. And it's something that is very unique for our region. We take action and then we issue the order to get compliance in the short term, and then in the long term, obviously the different levels of government kick in. One good example would be when we issued the Section 22 order on the mask. It was something that was needed on that short period of time, with the understanding that now what we are seeing is other municipalities are putting in their mask bylaws just to get that democratic process going and ensure that everything is in place to protect their health of their residents.
Thanks, Dr. Ahmed. And there's a letter to MPP McNaughton about petitioning the ministry on, I guess, more enforcement mechanisms for employers, or to impose enforcement mechanisms on employers to create a safe workplace. It's later on in the agenda, but because you're presenting, if it's okay, Chair, could I ask about that petition letter and your view, Dr. Ahmed, on what you would like to see coming from the employer side?
No, I think it's a good idea, Fabio, because it's all in the spirit of I think your initial question, where it's affecting not only the Ministry of Health but also labor, and basically it's. They might seem like sometimes they act too much like silos, and then this is an opportunity maybe to address your point. So yeah, I think it's appropriate. Dr. Ahmed?
My screen.
Yeah, no, he's.
Yeah.
Gary, you're not on mute.
Okay, so so I think as we all know that there are different aspects of how we are dealing with COVID. So COVID is basically one of those disease that is affecting pretty much everyone in the community, whether you are a business owner, whether you are a parent, whether you're a child, whether you have a school. So it's affecting everyone. So as complicated as it is, when we are talking about the employers and different rules and legislation each of these workplaces operate, and also the involvement of other ministries such as OMAFRA, when we're specifically talking about the agri-farm sector in our region, all of that requires collaboration and clear identification of the rules, role and responsibility, recognizing that many of the system that what we are seeing right now, especially in this pandemic, has generated a lot more, role and a lot more work for each of the organization that we are not prepared to address, knowing the complexity attached to it. So we do know that some of these enforcement that is needed at the workplaces is definitely something that falls specifically under the Ministry of Labor. And if there is any ongoing threat that is happening that we need to take action, that's when we take action. But again, we have to have some reason, some justification of what is happening. So for example, if there's a workplace where we know that there are active cases, and if the employer is not taking any action, our health inspectors will go in, and we have done that when we had some cases. We did some inspection, we did some walkthrough, make sure that they have all those things in place, and support them in having all these prevention measures in place. Having said that, there are a number of places which may not be in active outbreak, or there is no evidence that they have any active cases. So going into these places or these businesses obviously is not under the jurisdiction of the health unit, but we can definitely leverage our Ministry of Labor partner to maybe do some proactive work. So another example could be with the long-term care home and retirement home. We did active outreach to all of these long-term care home and retirement home to make sure that they have all those systems in place, because in some capacity, these long-term care home work with us on many of these outbreaks, but the same relationship do not exist with the workplaces. We do more on a health promotion type approach to the workplaces. So if this is something that that letter is asking the Ministry of Labor to do that, obviously we would be more interested in doing more of the prevention work, ensuring that they have all those prevention measures that is already identified in various guidance documents that is being followed, and there is someone who is actively ensuring that those measures are being taken.
That's. Oh, sorry. Go ahead, Chair.
No. I just want to add to some of the comments. We've just gone through a virtual conference with the Association of Municipalities of Ontario, and obviously the COVID issue was very, let's say, very lively discussions that were brought up. I know I made a submission with on behalf of the Western Ontario Wardens Caucus, and on the COVID-19 piece. I'm glad you brought this up, because there's so much misinformation out there that they think that the health unit has the superpower to deal with every aspect of the pandemic, and what we've identified is that that's not the case. And in the pandemic, what it's really done is really opened up, I think, the debate. And the ability now, because it's going to take ministerial intervention to put programs in place for the future. And it's healthcare, and then the long-term care facility issue, the mental health issue, Department of Labor or Ministry of Labor, OMAFRA, all of them now have to build some sort of a new way that we can deal with the future issues. And the other one was immigration as well. And so, folks out there have to understand that the health unit can only act beyond its scope of the Health Protection and Promotion Act. And yeah, there's some finite little differences in each of the regions. We've certainly found some of that, but the reality is there's 5 or 6 separate ministry, as well as those are just the provincial side of things, but then you got to add the federal as well, and especially with the migrant workers and how they're allocated to come into the country. So there is a lot of work to be done, and people have to understand that we don't set the standards on labor. That's done by the Ministry of Labor. We don't tell the farmers who they can bring into the country. That's done by immigration and so forth. So the pandemic has really peeled the onion back, and it really showed that the vulnerability of the system itself, and hopefully media can relay that message out there to different groups that. I know that the medical officer of health is a superhuman individual, but again, he's restrained by the kryptonite, which is called the Health Protection and Promotion Act.
Thanks, Chair. And it is a multi-pronged, multi-layered, coordinated effort, and we're learning that, and we've learned that a lot throughout this process. I'll end with a comment, and I have another question, Dr. Ahmed. But I'm of the view that employers have a duty to create a safe environment, and with or without a pandemic, they have that duty to not just themselves, but the workers and the customers that interact with the business. And so I'm hopeful that if we keep pushing the ministry, they could take an approach to hammer down on some employers, frankly. With respect to schools, Dr. Ahmed, it was mentioned earlier that each school board has protocols in place and are working on protocols. Do we know of any with respect to contact tracing? So hypothetically, if a teacher gets diagnosed with COVID, who would would health unit intervene and get involved in which students now need to stay home and what happens, or is that going to be left to the school boards to deal with? Because I know the former trustee and even as a counselor now, a lot of concerns that I get actually are coming from parents of schools, and so I figured that this would be the appropriate venue to ask.
So thanks, Fabio, for this question. I think it does have shared responsibility at certain level, and obviously many of the plans that we are working with the school board need to be aligned, and there are certain systems that the school boards need to have in place with respect to screening and identifying how they would identify if someone is exhibiting any symptoms, what those symptoms look like, what are those symptoms check look like before everyone is coming in. So when in our plan, we did ask about anything that happens before someone is entering the school, is to doing the health assessment and ensuring that they're okay to come to school. And at the school, let's say if it's a teacher or if it's a student, if they start to show any symptoms, what does it look like that how those individuals are identified and then maybe brought into a separate room for further assessment or further discussion. And then at the time, if they will have a screening questionnaire that they will go through. And once after they go through that screening questionnaire, if they meet that criteria to be considered as for COVID-related symptom, then they will have a conversation with the health unit. So that would be like if you have a case. And when health unit will get in touch, we'll go through further screening, and then we talk about any additional needs. For example, if this child needs to be tested or if this child needs to be sent home, and what does it look like, who would be involved, whether it's a primary care provider or others. So all of those conversation happens. And then at that time, obviously, we will be, because we don't have a case yet, and there will be suspicion when all those previous measures that we would have with respect to physical distancing, masking, and ensuring that everyone is monitoring their symptoms every day, we will work on that. Generally, we are getting the results back very quickly. So, for example, if someone is tested and we get the result, the moment we get the result, and if it's a positive result, it would trigger the same case and contact management investigation by the health unit, and then we will collect all that information, and the school board will provide all that information, who is in attendance in that class, who this teacher worked with, and all those details. And then we will make a determination that who needs to be self-isolated, who need to be monitoring those symptoms, and whatnot. So we have in the interim a high-level plan, recognizing that a lot of those details are coming down through the Ministry of Education and Ministry of Health. They have their own outbreak plan for the schools, and we are waiting for that plan. Once that plan comes in, we will incorporate it into our plan. It won't be like entirely different than what we do, but get a little bit more specific, knowing the school environment and some of the challenges with the school. So once we have that, we will share that with the general public as well as with the school board. But right now, we have a high-level plan that we worked with, at least with one of the school board, and that's what we are working on right now.
Wonderful. Thanks, Dr. Ahmed. Thanks, Chair.
All right, thank you, Fabio. Joe.
Yeah, thank you, Chair. Again, just following up on Fabio's question regarding school openings, Doctor, and I know, Teresa, you mentioned earlier you're working on some more details. Coming back, being practical, right? Reading your report, I want to thank you guys for a very detailed report. It's 41 pages, and I took the time to read it once, twice. There's a lot of information. There's a lot of policies, policy this, policy that. It's very overwhelming when you have to do things within 2 weeks. And, speaking as an administrator of a school and my colleagues, that's the concern, is that we want to make sure that we have things right, that we don't, we don't go against any policy that's out there. And on page 17, it talks about, and you alluded to this, Doctor, the Ministry of Health and the Ministry of Education will be providing outbreak guidance for schools. This will include requirements for notification to public health. But we're 2 weeks away. Next week, I like to be prepared, and I know a lot of schools want to be prepared, and that's information that we want to try to get as soon as possible. But I'll just give you an example, and these are the concerns that I'm hearing, speaking administratively, is you have how many schools, how many kids in a day will come to the office to say, I have a sore throat? Or a teacher sends them to the office, they're not feeling well, they're coughing. So now the teacher sends them to the office, the secretary, the principal, vice principal have to go through these steps. And again, there's this policy that we'll follow, may or may not go to the isolation room. Do we then go on to, where do we go from there? if they don't, you call home and the parents say, well, that's just allergies. I'm at work, I can't pick them up. Those are allergies. We need more substance when we come back with the Ministry of Health, or if they come up with a plan. Is what do we do then? Do we, as administrators, send them back to the classroom, or they have to be picked up by the parents? And that's the part where is the gray area. If maybe when you're dealing with the ministry, if you can clarify that so that there's very specific, we know who does what when these kids get sent to the office. And again, the larger schools, you're going to have more kids. And especially flu season, they're going to come down and maybe 1, 2, 3, 4, 5 in a day. And so if we have kind of that protocol based on this page 17 that is referred to in the guidelines, would really help us. So that's more of a kind of a suggestion if we can look into that. The other part, if you could clarify, Doctor, this 1 meter versus 2 meter, everyone's fixated on that. The minister suggested with the masks, with social distancing in a classroom, a student sitting at a desk, 1 meter is the number he gave out. But then the health unit and the guidelines I'm reading is recommending or suggesting 2 meters. So my staff is going to ask, is it 1 or 2? And obviously, if we can do 1.5 or we can do 2, that's great. But is 1 meter acceptable? Because again, next week they're coming in, we're setting up the rooms, and they want some clarity or some direction on that number. If that 1 meter could be, obviously the 2 meter is ideal. But what's your comment on that in terms of where we stand?
So we did, we are aware of those differences and some of the conversation that goes with the 1 meter versus 2 meters. I think from a purely public health perspective, we have stick to what the recommendations are that we have been giving to everyone across the entire region, every businesses, everyone. And as the local medical officer of health with high number of cases in our region, I have said it very clearly that we should be following 2 meters distance, because that's the distance that is that makes that has been our message right from the beginning. So I don't want to change that message, because knowing that in other jurisdiction, WHO, they talk about 1 meter distance is sufficient, but we have always gone above and to ensure the safety of our community in the province, and we've used 2 meters distance. So locally, that is my recommendation, that we should stick to 2 meters distance between students.
Okay, so again, when we're questioned, recommending 2, if they do 1, that's okay, or recommending, or is it a must?
Well, we do not oversee, or we do not put any restrictions on the school board. So the school plan need to go to the Ministry of Education, and I think they are the one who is approving all their plans. Locally, obviously, they're asked to work with the public health, and in their guidance document, they do say that follow the public health recommendations in terms of any differences in what is in their recommendation. So based on that, we feel that 2 meters is the right distance. And again, class size, it really depends on the size of the room. So we are recommending using 2 meters as the marker to determine the class sizes.
Thank you very much, Doctor. And again, that is what it's in the guidelines in terms of the return to school plan. But again, when we're questioned, they hear that from the minister level, and it kind of gives that conflicting message. But thank you for clarifying, and that's the number that we'll be using. Thank you.
I believe Judy had her hand up first, and then Ed.
Thank you. I think I'm off mute now. Just following up from some of those questions, I'm wondering about Dr. Ahmed, some current and anticipated numbers with respect to the public testing and screening sites in the city of county. How many we have right now, and how many we anticipate needing in the fall. I'm aware of people who've gone for tests and screening and had to take about 3 hours, and wondering what our acceptable level of wait time is. Just thinking about, as Joe was saying, how you'll get this number of students that will then, on a daily basis, possibly being sent home, which means parents have to take time off work, What's the anticipated, like, who will get involved in that? Is that something the health unit will get involved in the testing? Will they go to these standard public testing sites? Are we looking at acceptable wait times? I'm thinking, again, a lot of parents, it's been financially difficult for them to this point, and thinking about having to be taking regular time off to be getting testing, how we're looking to handle that.
Did you
Thanks.
find out what happened, or because we play with it?
Yeah, we won't play with it anymore.
Ed, please.
Okay, so there's obviously there's a number of variation that how long it's taking to get the test done, and I am aware that sometimes it's taking hours, sometimes it's taking minutes, and sometimes it's just basically walk into and get your test done and go home. So it's hard to predict. Right now, there's 2 assessment centers, as we know. One is in the Ouellette campus, Windsor Regional Hospital, and another one is in Leamington, and Windsor Regional Hospital will be opening up another assessment center at the Met campus. But when we're talking specifically about the school, we are, our team is engaged in that conversation with the group that is overseeing some of these activities, especially with the testing piece, which is obviously it's an Ontario Health-led initiative. And then there is a testing protocol that is currently being developed at the ministry level, specifically looking into the unique issues with the schools and what does that look like. Locally, there has been some conversation with the primary care providers as well, that what it means, as Joe was mentioning as the principal, that your child is having some sniffles, and what does it mean whether they should go and get everyone should be getting tested, or maybe there's a role for the primary care provider, and what does that role look like. So all those conversations are happening. We do anticipate that we agree that we need clear criteria of who should be tested, and once that determination is made that this child needs to get tested, what does that look like, and whether there would be a nurse in the school facilitating that testing, or maybe these children are referred to their primary care provider, or some primary care provider who are able to do that testing, or they're going to the assessment center. So those are all good questions. And hopefully before we get to that starting point, we will have that. But right now, in the interim, I would anticipate that any of these things that require testing, it can be either or any of these options. And I would assume that right now we're also talking with the hospital as well to see if there's anything specific that can be done for the pediatric population. But those are all the conversation that is happening right now. I don't know if Prisa, if you...
Great, thank you.
Okay, thanks, Judy. Ed?
You hear me?
Yep.
Okay, that's great. Thank you very much. Some of my constituents, they have been actually calling me on the phone, and they were saying that the school system is going to open up, or the school is going to open up in the next couple of weeks. And most of them, they are really concerned because they are watching the American school system there. And there is so many students have been infected, and they are afraid even to send their kid to school. And they asked for my opinion. I said, you gotta get in touch with the medical officer of health and see what we can do. We can make a decision on it. Usually it comes from the province. So can you comment on it? What we give them? I know we can't give any assurance to anyone, but how do you handle it? What do you say to them so they don't end up with a problem, their kids sitting at home and doing nothing?
So through you, Mr. Chair, we did send out, we posted on our website, and we shared it through our social media, a letter to parent through me, which is exactly the intent is to touch on all of these topics, that what we expect, what to expect when your child is going to school. There is a certain level of responsibility that all of us has to take. And as you rightly said, that I've been very clear that there is no risk-free option. If you're sending your child to school, there is a risk. If you're not sending your child to a risk, still it's not a guarantee that your child will never contract COVID. And there are other issues that you have to take into consideration about from a perspective of their brain development, their physical activity, their mental health, their social well-being, all those activities that needs to be considered. So you as a parent will be in the best position to know about your child and what they are able to, or what their limitations are, or how they would behave. So each of those decisions would be individual. And if your child or have any health issues, then this is a conversation that you should have with your primary care provider, with your family doctor, to see if my child is going, whether it's a good thing to go or whether maybe they should stay home based on their medical condition. So there are a number of factors that they need to consider. The school board is obviously if someone is in the school who is sick or who has COVID, it would be an eventuality. I think there will be a situation when you will have cases in the school, and I won't say that the system is perfect and you will never have a case in the school. Absolutely no. There will be cases in the school, and there will be some implications, and we just need to see what is how much risk we are willing to take, and knowing that we have all those systems in place, and even if nobody's going anywhere, they're trying to reduce their risk. But again, with some of the other needs, there has to be some decision. And so if you haven't seen that, we posted it this morning, but I've said this at least a couple of times in my media briefing, what to expect when children are going to school. The letter is up on our website and it can be accessed. And maybe if you can refer anyone who is watching or anyone who has some of these questions, we used some of the information that our other colleagues in the province have used. It's a good collection of information. It's concise, and it would help them make a decision.
Dr. Ahmed, those people, they're talking about their children. It's not talking about an average person. Of course, they love their children for sure. And what is the consequences if they I don't want to say refuse outright to send their kid to school? What option or what consequences those parents? Are they going to go to jail? They're going to pay thousands of dollars of penalties? Just kind of brief on it, if you can, please.
No, I think even the Premier mentioned that it's an option. Anyone who wants to send their child to school, that option is available. Recognizing that for many families, with both parents working, they don't have the ability to educate their child at home for various reasons, and they are the one maybe who don't even have a choice other than to send them to school. From the school perspective, there are at least 3 streams that I'm aware of that is available to all parents. So they can go in person, attend the school. They can attend online in a synchronous versus asynchronous model, where they will have some instructions directly online live with the teacher, who can go with back and forth dialogue that they can have with the teacher. And then there will be other model which some of the students were using throughout in the beginning of the pandemic when the school initially closed, with instructions that a student can learn offline at different time based on their convenience. So there are a number of options available. Obviously, there is no penalty attached to it. No one is penalizing any of the parents, but I guess from a public health perspective, and even as a community, we want our children to be educated. We don't want to miss out on that opportunity to not to educate them. There are a number of options available, and every parent need to look to their own situation and find what is the best option for them.
Dr. Ahmed, probably I'm just making a general statement. Those people really are really concerned. They watch the American television quite a bit, and they see in some school, like out of possibly 800 students, they say 500 have been infected. And I think this is what it concerns them. And I know you answered my question. I just want to say thank you so much. I hope that pandemic will be behind us anytime soon. Thanks again.
All right, thank you. Thank you, Ed. Any further questions to Dr. Ahmed on his report at this stage? Okay. Then I'll take actually a motion to receive his verbal report here. Larry and Gary, all in favor? Those if any, that's carried. All right, new business, 5.1, the planning and recruitment of school-focused nurses in public health units. I believe that's Teresa. I'm going to refer that to you.
So just to make you aware, and it's in the board package, the province has committed to 15 nurses for our public health unit. It's our understanding the 15 positions will be 100% funded by the province for either a 1 or 2 year term, specifically to support the work in the schools regarding COVID and in particular in an outbreak situation. So even though we have practices and protocols in place, as we have dealt with other infectious diseases in the schools, this will really be a dedicated group to support the schools. As we use other nursing staff, it's our anticipation that nurses will probably have about up to 10 schools as a primary resource for a group of schools, and we'll work with our health unit staff to make sure that the needs of the schools are met during COVID. As well, we are still awaiting the outbreak protocol from the ministry. It will help guide us with further direction for these nurses. These nurses are in addition to the board-approved nurses in July. Those nurses will be working on case and contact management. So any case in the school, whether it's a staff or a student, will be followed by our nursing group that is responsible for case and contact management. But these nurses, funded by the government, will be more directly working and supporting the work in the schools. So we're doing the recruitment right now. Dan's department's very busy as they're recruiting the staff, and that's it.
Any questions to Teresa? Fabio?
Sorry, Chair. Teresa, are all the nurses going to be in the school? Like, are all these nurses going to be allocated to schools, or are they going to be spread throughout? I missed that part.
So right now we have about 163 schools across Windsor and Essex County, and we do have nurses previously to COVID that were assigned a group of schools each to do health promotion and support the schools. Our nurses in the schools pre-COVID also were assigned for vaccine, and these nurses will be dedicated to the schools. It's not that they're going to be physically sitting in the school, but they will be supporting a group of schools. So this 15 with some others will probably bring us to about 20 nurses that will be supporting, the schools during the rest of the pandemic.
Okay, thank you. And as it relates to, and so this would be shared across all 4 school boards, obviously. And as it relates to their movement within the schools, they'll just be they'll be kind of floating amongst different classrooms, or will they be situated in an exact area at each school amongst different schools? Is that kind of the idea?
They will be a resource to the school, and they will also be accessible, but we haven't figured out that model yet. So a nurse, if she has 10 schools in her workload, she wouldn't be physically sitting at each of the schools, but more of a participating and being that resource and being more involved as needed in whatever capacity. So all the health units are basically working together to try to develop some really concrete roles and responsibilities and similar functions. And even when you talk about outbreak, the testing part of it, our health units, or our health unit with nurses in the schools or assigned to the schools, we may consider doing testing in a school setting if that's required. But every outbreak, every cohort or whatever it is, any case will require more collaborated efforts between the schools and our health unit. But at least we'll have a nurse that will be directly, you know, a key resource for the principal, for the school. And, you know, so it's really good. It's good that the province recognized that. We would not have the capacity to do this in addition to all the case and contact management. So, you know, we're pleased with this. 15 is okay. It would have been nice to have a little higher number for our area based on what we've seen through this pandemic, but we'll take what we can get at this point.
And lastly, thanks, Teresa. I appreciate all that. And lastly, with respect to the province, without getting into the weeds of their plan, there's been no material in terms of funding and support. There's been no material change or alteration from the province to reduce class sizes that we know of. So it's left to the school boards on their own volition if they have the resources to reduce class sizes. It would be left to the school boards. Is that correct?
Yes, and what we're seeing right now is that we're getting some school boards across the province are looking at other settings to hold classes, such as community centers and other possibilities. So I don't know locally what the discussion has been locally, but I know that has been a common discussion on some of the groups I sit on, that they're hearing that schools are looking outside of their actual physical building.
And as a general rule, and I know there's exceptions and variables, but as a general rule, would it be the health unit's position that the smaller the class size, the more we're able to mitigate risk? I mean, it seems self-evident to me, but would that be the position of the health unit? If there's ways to encourage smaller class sizes, that should be the way in which school boards should move in that direction?
The 2-meter distance would take care of that and would be probably in the best interest of our students. And we have seen that the inability to physically distance is an issue. We've seen it in the migrant farms. We're seeing it in workplaces. St. Clair College recently had a case, and we had reviewed their plans previously, and the 2-meter distance was in their plan. They didn't question it. They have other practices in place, and we'll see. I know it was only one case, but I don't think any of us here at the health unit would disagree that putting whatever measures in place to protect the students, the teachers, is best beforehand. And
presumably the 2-meter distance is easier to be met when the class size is smaller than when it's larger. Just general logic, right? So I want to go back to the class size, because I think that's an important piece. Would it not be the health unit's position that a smaller class size, because of the 2-meter distance, would be more favorable than a larger one if school boards have the choice?
I will look at our medical officer of health to.
Yeah, I think as I said, we do not directly oversee all these schools. So it's the school boards are basically asked to work with the local public health unit to look for guidance, and our 2 meters recommendation is been consistent, and I think we have been using that for everything. So why change it now? So that's the kind of stance that we have, and we hope that the school board will follow that, and it is. I think that's all we can do.
No, I just want to jump in on this, but to Bob's point, I know. I guess when push comes to shove, and the province is saying it's X, and the school board says, well, wait a minute, our local medical officer of health here is recommending 2. We need to go to 2. But now it's a space arrangement, and that's going to be required. And so who wins the battle at the end? I think that's I think that's where I think the question is leading. But at the end of the day, I think consistency in the plan, and if 2 meters was the ideal situation and so forth, it makes sense to say we need to be consistent.
Yeah,
Thank
and
you.
even on top of that is we know that even with the adults, we know that not everyone is wearing the mask properly. So it's also one of those things that we have to recognize that when we are talking about these children and how I guess over the time, the entire 5 hours or 6 hours when they're in school, how consistently they will be wearing the mask. So I think that's why we feel internally that it is important that we stick to our 2 meters distance, which is critical and which has shown to be effective. At least, if nothing, if they are physically spaced out better, they will be in a much better position from a prevention perspective.
Thank you. Thanks.
Reno.
Thank you. Just this is sort of a tangent, but Teresa did mention it. So we're looking at the addition of these nurses and the funding for these nurses. But has there been any conversation since the request for increased staffing and funding for the positions that we requested at a previous board? From the provincial government or ministry at all. And again, these 15 nurses are nice and good to have, but the request that we had made was much larger and different. Is there any conversation at all happening with that request?
I'll defer that to Teresa.
So we have not received our budget for this year, so it was an amendment to the budget, and that was submitted. We had a follow-up call with the our contact at the ministry right after the board meeting. But I think they all recognize the need for human staff resources at our health unit. But we have not received our budget approval for this year or any further information. So that was an amendment to the existing budget, but nothing further. We were hoping it would be this week because of AMO, and we thought that it would be announced, but it hasn't. But we are told that it's coming soon, as is the outbreak document for schools.
But to be clear, the 15 nurses and this additional staffing has nothing to do with our request and won't conflict. You're not going to hear something from the government saying, well, we just gave you 15 nurses so we could cut back on these 2 or 3 that you asked for.
This is a very separate initiative from our ask, so we need the other staffing.
Explain, I think, I'll jump in. If you look at all of the jurisdictions, Reno, I'm looking here, there's every health unit across Ontario are 15, but to give you examples, Brant County 5, Chatham-Kent 4, City of Hamilton 19, 36 in Ottawa. So you can see all of them have been given these numbers, and I think it's part of it is because in the last I'd say the last 3 weeks, the whole school issue and trying to give, I guess, some comfort and to parents and others that they're going to up the staff of medical people. So this is more one area or one point of attack, basically looking at the school piece and that. What our requirements here is more universal on our operation.
Perfect. Thank you.
Anyone else? Okay, I'll certainly entertain a motion to receive the report from our CEO. Judy and Joe, all in favor? Opposed, if any, that's carried. Thank you. Other board and health resolution, we've got letters here. We'll deal with 6.1 because it's on that. It's a letter that was sent on behalf of our health unit under the signature of our medical officer of health, and it's basically the Ministry of Labor find means to encourage owners and operators of the agri-farm sector to accelerate testing of their workers for COVID-19. So that's been sent, I believe, and the other is a letter that was penned by myself and as well as on the to Deputy Minister Ellen Angus, and it's something that our board had alluded to on the pandemic pay issue, and to making sure that they look at expanding, because of the frontline, other workers should be recognized for the duty. So that letter was sent off as well. We do have 3 letters from town of Essex, Kingsville, and Amherstburg, and it's basically supporting town of Essex requirement for more in-depth, I guess, information.
If I can speak on that, Chair, just for a second.
Yes, go ahead.
Yeah, okay, on this letter, I'm happy with I'll just let the board know I'm very happy with the information we get on a daily basis. We get an update every single day from the health unit. So just to let the board know, I'm happy with what we are receiving in information. So just let the board know that.
Thank you, Larry, for that. So if I can have a motion to receive the letters. Gary and Ed, and no further discussions. Judy?
Sorry, are we going to have a chance to discuss, or are we just motion to receive them at this point, or we have some time to discuss? I did have a couple questions.
Go ahead.
So I guess I'm just wondering, the town, and there have been requests for more raw data, and is there a plan, is there a rationale for the level of data we're providing as compared to other municipalities, and what the response is to these requests for more information and raw data that you can drill down to?
Oh my God.
So thank you for the question, and I think I addressed it at least a couple of times in our media briefing, because the media is also aware of all these letters. So the first thing that I would acknowledge that Windsor-Essex Health Unit do not have the same resources that the City of Toronto have, or some of the other larger health unit have. We have a total of right now 2 epidemiologists and 1 epi manager and 1 data analyst who is supporting all that data need. And the amount of data that we are producing goes above and beyond the capacity that we have, and it's at a comparable level to many of the bigger and larger health unit with much larger resources that they have. So having said that, some of the data requests that we are getting, we have been providing that information right from the beginning of the pandemic. When it's questioned about raw data, and maybe it's because we have different understanding of every terminology that we use. When someone is saying raw data means something different to me. Raw data means you're asking me specifically about where is this case, who's this case, what is happening with this case. That information cannot be shared simply based on it's a personal health information that we can never share. Any information that we are sharing from a public health perspective, it has to have 2 reasons. So first is it should not be identifiable, and the second is for even when we are putting that information, what kind of action that is needed and who need that information for what purposes. And I've heard this term loosely that we need that for our planning purposes. I don't think that the data that we are providing, it can be used for any kind of planning other than what we are providing you with the aggregate numbers. Some of these reopening and some of these conversations, these recommendations, these decisions are happening at a much higher level and not at the level that that allows us to look at and drill down that information. Some of the information, when we are going back with the municipalities level and going and drilling down into the neighborhood level, with the population density that we have, giving all of that information can easily identify anyone, and we'll be putting ourselves at a liability of disclosing personal health information or putting any individual at a risk of stigma. There are a number of things that happen in the community that shouldn't have happened based on the kind of reaction that we have received when it comes to identifying any individual. If it's my personal health information, I don't like to be shared, same as I respect everyone's personal health information in the region. When we're talking about the stigma, the kind of situation that we have seen, it's again, there is no public health action attached to it. There is no municipal action attached to it. So raw data is definitely not something that we can share. But we have made certain changes, certain requests by when we received this information. We always ask our epidemiologist, not for because we have been asked this question, but even just for our purposes, our action, what more we can make some sense out of this data. How can we use this data for our own planning, our own information, and also support the municipalities in terms of whatever they are doing to assist them in their planning. We have our table with all the CAOs of each of the municipalities. So if they're doing any of these planning, if they're looking for some kind of data support, we are connecting with them directly. We are providing them with the information that they need. So I think there are a number of conversations that is happening. We have added number of new data elements to our existing database on our website, and we will continue to do that. Some of the information that we have shared in our EPI summary, it hasn't made to the website yet, just because of some of the logistics that goes into posting those. But those information, you will see some of that information on a regular basis on our weekly update EPI summary. And but the intent is the future looks like all that data that we are producing, it should be up on our website. So anyone can go, whether we're talking about general public, whether talking about municipalities, they can go and access the information that we can share. Anything that is not there, either it means that we are unable to share that information, and if any of the municipalities have any special data request, they can ask that. And one example that I can share is when the township of Kingsville and Leamington, when they were in stage 2, and when they were in stage 1, when the rest of the region moved into stage 2, they had some unique data requests that we started to share with them, with specifically zoning down on their numbers, differentiating with their farm workers, with the rest of the community. They wanted that data. We shared that data. So I think all of those data now we are creating for each of the municipality. Every municipality now have their own municipal epi curve, which drills down to every weekly case counts of what is happening in the community, what the trends look like, what's the moving average. So all those data is there, and we will continue to provide that. So any of the municipality, if they have any unique data need, we're more than welcome to connect with them and see the feasibility based on our human resource availability, and also any potential privacy issue. If it's not there, we will share that information.
Okay. Okay, I see Reno's hand. Go ahead.
And sorry, just following up on that, with respect to the communication with the municipality. So we have 3 letters here. I've been seeing a lot of action on this, and trying to decipher, what's a real request and what's, what looks like posturing for political gain. Those conversations and everything you just asked, have they actually asked for this data? Have they asked for what the data for those specific plans, as they say? I mean, they allude to planning or allude to needs in their community. Has there been a conversation between yourself and those municipalities or those CAOs? Because what I've seen is what it leads to is prejudicial comments, and then finger pointing in the community. And we've heard it, I heard it last week at school board meetings talking about it, and basically pointing fingers to certain groups. And I'm trying to understand, what do they need the data for? And if they need it, did they ask you for it, and why not? Or what are they exactly trying to get from you?
I haven't received any data request from any municipality directly that they're looking for any specific data for a specific purpose. We received these letters, and that's and I don't know, Teresa. I don't think that she has received anything, but I'll let her.
Just a lot of MFIPA requests related to similar requests from not from councils but from other people, and we're dealing with those separately, and in a lot of cases through our lawyer. But regarding the response to this particular request, we are going to respond and say that anything that we can disclose is on our website. And that really is the advice of our legal counsel, is that the more we can populate our website and direct everyone there, then that's as transparent as we can be. Anything that is more personal, data that can't be shared or could possibly disclose information will not be shared. And this has come up as well, even with the schools. As the schools reopen, we've had direct requests to share the name of a student in a cohort, in a classroom, so everyone else can determine if they're at risk. And we've never done that in the school setting, and we share as required, in whatever setting, like at a higher level with the principal and the school board to get, further information, but not for the purposes of disclosing someone's personal health status.
So without having to, make a motion to this, could we also include in that letter that, sort of a synopsis of Dr. Ahmed's original response to Judy's question insofar as, regular meetings with the CAO and any specific data sets that are required for planning purposes, that they just simply ask in those meetings, and not to have to generate letters and motions of council to actually have a conversation with the medical officer of health that they have on a regular basis. So, thank you for the comprehensive answer. And it's frustrating because you constantly hear this out in the public, that there's not enough data, not enough data, not enough data. And what they don't realize is that, the data is there to protect people's privacy and to protect from people pointing the finger and just creating scenarios where it's an us versus them, and those are the people who have gotten tested or testing positive. So if we can include that in the letter and maybe even ask them to review this video answer, because I think Dr. Ahmed's response was a great response, and I think everybody in those municipalities have to hear that answer. So thank you.
Duly noted. Thank you for that, Reno. Okay, so then we'll add that piece, in terms of instead of the motion to receive, and we'll send them the proper response. So if that's okay with the original mover and seconder, we'll sort of amend that. Okay, all in favor? Opposed, Penny, that's carried. Thank you. Any further business that members of the board would want to bring forward? Okay, next meeting, September 17th. No further business, then adjournment is certainly in order. I'm going to use Tracy and John. All in favor for adjournment? Carried. Thank you very much, members of the board.
Good night.
Night.